Okay, brachial plexus. So with the brachial plexus, remember this is gonna be a plexus or kind of like an entanglement of ventral rami. So you have the spinal nerves, remember those are gonna split into your dorsal ramus and your ventral ramus. The ventral ramus is what's coming here, that's these, okay? So what we call the roots of the brachial plexus are really the ventral rami, okay? So the roots are gonna be C5 to T1 for the brachial plexus. So we have the ventral ramus of C5, ventral ramus of C6, C7, C8, and T1. We do have a little bit of T2 just kind of here, but we're gonna focus just on the brachial plexus stuff. So with this, the first thing you wanna do when you're first learning the brachial plexus is split it into just basic components, right? So you're gonna have roots, trunks, divisions, cords, branches. And by branches, remember that means terminal branches. So you're gonna have 5 terminal branches of the brachial plexus, but then you also have all those other branches that you don't want to forget. So starting with our roots, remember those are going to be your ventral rami of C5 to T1. Then you're going to have certain roots kind of joining or continuing on to form your trunks. So here you can see the ventral ramus of C5 and C6 are going to join to form your upper or your superior trunk. C7 here is going to just basically continue as your middle trunk. And then C8 and T1, the ventral rami of those are gonna join to form your lower or your inferior trunk. Okay, so we're having joining. Then after your trunks, you're gonna have division. So each one of these trunks is then gonna have division. So each one is going to have an anterior division and a posterior division. So you have 6 total. You have 3 anterior divisions, 3 posterior divisions. Now, let's start with the posterior divisions because they're easier. So the posterior divisions, all 3 of them from each trunk. So you have a posterior division from the superior, middle, and inferior trunks. The posterior divisions of each of those are gonna come together to form the posterior cord, okay? So the posterior cord is actually back here. So if you look in here, you can actually see pieces from each of these kind of coming together. That part's probably hard to see on the video, but all 3 posterior divisions are coming together to form the posterior cord, okay? Then the anterior divisions, the anterior division from the upper and the middle trunks are gonna join to form your lateral cord. And the anterior division of the inferior trunk is just gonna continue on as your medial cord. So at this level, we now have 3 cords. We have a lateral cord, a posterior cord, and a medial cord. So why are these called what they are? It's because you normally have your axillary artery traveling right here. Okay, so you'd have your lateral cord is just lateral to that axillary artery, the posterior cord is just posterior to it, and then the medial cord is just medial to it. So that's why the cords are named what they are. Then each cord is going to divide into essentially 2 terminal branches. So with that, let's start with our lateral cord here. So this is our lateral cord. It's gonna split into 2 things. So it's gonna split into your musculocutaneous nerve and the lateral root of the median nerve here, okay? Your medial cord is gonna also split into 2 things. So it's gonna split into your ulnar nerve and the medial root of the median nerve. Then the lateral and the medial roots of the median nerve come together to form your actual median nerve, okay? So with that, that's gonna give it this classic like M shape. So if you ignore the rest of these branches for now and just look at this part, see this M? That is formed by those branches. So your lateral cord splitting into musculocutaneous nerve and the lateral root of the median nerve, and then your medial cord splitting into your ulnar nerve and the medial root of the median nerve. That gives it that classic M. So when you're trying to orient this in the body, that M can be a really good reference structure. So just keep that in mind. Then if we flip this kind of out of your way now, the posterior cord is also gonna split into 2 things. So this is your posterior cord, and it's gonna split into your axillary nerve, which is gonna be shorter, and it's going to be a little bit smaller than the other branch, which is your radial nerve. So this would be your axillary nerve and your radial nerve, okay? So each of those cords has split into 2 things. It's just that you only have 5 terminal branches because the 2 roots of the median nerve are forming 1 actual nerve, okay? So each one splits into 2 and you have 5 terminal branches. That's like the general components and overview of the brachial plexus, but of course it's not going to be just that simple. You have other branches that come off that aren't terminal branches, okay? So that is a good starting point. If that's new to you, kind of stop there, digest that, and then when you're ready to learn more, come back to this, okay? So the other branches, I like to split this up by where they're coming off the actual plexus. So you're gonna have some branches that are coming off the actual roots. You're gonna have some branches coming off your trunks. You don't have any branches coming off the divisions. Then you're gonna have your cords. You're gonna have branches coming off the cords. So with that, let's start with the roots. So coming off of the roots, you should typically find, see that little guy? I don't even know if you could see this in the camera, but that little guy that's going up, and then on this side, let's see if we have it on this side. Yeah, probably that. That's gonna be your dorsal scapular nerve, and that typically comes just from C5. There's always gonna be some sort of variation. Well, not always, but in some people there will be variation, but classically, this is gonna come off just C5. So this can be a really useful nerve to test in the clinic if you're examining your patient, because remember that the dorsal scapular nerve is gonna go innervate your rhomboid minor, rhomboid major, as well as your levator scapulae. So a simple test that you can do is to have your patient retract the scapulae, because that's what your rhomboid muscles do. And if they can't do that, then there's probably some sort of issue with the dorsal scapular nerve and potentially at the level of the spinal nerve, C5. So that can be really helpful since it's just one. The other nerve that you should be aware of that comes off of the roots is this one, which is your long thoracic nerve. So you can see there's a part coming from here, a part coming from here, and a part coming from here. So the long thoracic nerve is gonna come from C5, C6, and C7. And it's gonna then go and innervate the serratus anterior muscle. So remember, the serratus anterior muscle is gonna start along the ribs and then go and insert on the anterior surface of that scapula. And so when it contracts, it's gonna help hold that scapula against the thoracic cage. And so we also call it the boxing muscle, because if you throw a punch, that's gonna kind of keep your scapula retracted on your back, so it's not like winging out. So with that being said, if you do get an injury to the long thoracic nerve, you get what's called scapular winging, and the scapula on your patient will literally be winging out. So with that, it is a fairly, I don't want to say common, but it's a little bit easier to injure than some other nerves because it's really unique actually. It innervates the serratus anterior on its superficial surface, whereas most nerves are going to innervate the muscle on its deep surface, so it's not as well protected, and it does travel like right along the side of the rib cage essentially, and so this can commonly be injured in certain surgical procedures like a mastectomy, for example, because it is located superficial to that muscle. So that's your long thoracic. So C5, C6, and C7, long thoracic nerve, serratus anterior muscle, scapular winging, high yield stuff. So here, this one is torn right here, but it should have contributions from 5, 6, and 7, which you do see on here, which is pretty cool. So if I kind of pull that back, you can actually see that, okay? Then something else to note that's not really visible on here is that C5 does have a contribution to the phrenic nerve. So that's just something to keep in mind, is if you have some sort of brachial plexus injury or injury to C5, you may have some weakness with the diaphragm because the phrenic nerve innervates the diaphragm. So remember, phrenic nerve C3, 4, 5 keeps you alive. So we're not seeing C3 and C4 here, but you would have a little bit of a contribution coming from C5 to go to the phrenic nerve. So just something to keep in mind. That's kind of it for the roots. Then you'll have coming off the trunks, you do have this nerve, which is pretty significant size-wise. This is your suprascapular nerve, and this is typically gonna come off that upper trunk here, or that superior trunk. And so remember, the suprascapular nerve is gonna go and it's gonna travel in that scapular notch, just underneath that transverse scapular ligament. And it's gonna then go innervate your supraspinatus and your infraspinatus muscles. And those are 2 out of your 4 rotator cuff muscles, right? So remember, the supraspinatus is gonna do abduction at the shoulder joint, typically about 0 to 15 degrees. So it initiates abduction. And then your infraspinatus is gonna be the major external or lateral rotator of the shoulder. And so with that, if you wanted to test the suprascapular nerve, which is C5 and C6, that's how you could do that. You could test the function of initiating abduction. You could test the function of lateral rotation. You do also have your teres minor muscle, which helps with lateral rotation, but it's only gonna be like 10 to 20% of lateral rotation. The majority of lateral rotation is gonna be from your infraspinatus, which is innervated by this suprascapular nerve, okay? So that's coming off that upper trunk, so you can identify that there. Coming off the middle trunk, you don't typically have any, and coming off the inferior trunk, you don't typically have any. So then remember, we had roots, trunks, divisions, cords. So with our divisions, you don't typically have any branches coming off of there. So now moving on to our cords. At the cords, you are gonna have lots of branches. So let's start with our lateral cord here. So this is our lateral cord. And coming off the lateral cord, you have one nerve. It's your lateral pectoral nerve. So you can remember that because it's the lateral pectoral nerve, comes off that lateral cord. So with that, remember the lateral pectoral nerve is going to innervate the pectoralis major. Specifically, it's only gonna be the clavicular part of it. So that can be helpful for extension at the shoulder joint. Whereas coming off the medial cord, you're gonna have your medial pectoral nerve, which I don't think that it's really super visible on here. Yeah, I don't really see it, but you'd have, maybe this is what's left of it, maybe. Ooh, maybe that, no. But anyway, you'd have the medial pectoral nerve coming off the medial cord here, and the medial pectoral nerve is gonna go on to also innervate the pec major, the rest of the pec major, so like your sternocostal head, and also your pectoralis minor. So it's gonna innervate the rest of the pecs. So with that, you have the lateral pectoral nerve and the medial pectoral nerve would be coming off here. And if you remember, when you look at those in the body, lateral is going to be located more medially, and so it's confusing, but just remember they're named by where they're coming off the brachial plexus. So the one that comes off the lateral cord is the lateral, the one that comes off the medial cord is the medial. There's two other branches that come off the medial cord, and they also both have medial in the name, which makes it a little bit easier to remember. So you'll have your medial brachial cutaneous and your medial antebrachial cutaneous nerves. And so the way that you can remember that is medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. So these are literally just sensory nerves that are supplying the skin on the medial arm and medial forearm. So sometimes you'll see them coming off separately, like you're seeing on this side. So like that, or actually, ooh, there's a good medial pectoral nerve there for you. But sometimes you'll see these medial cutaneous nerves coming off separately. Sometimes you'll see them coming off together. So this side has them a little bit more separate. And then this side, you see it kind of comes off as one and then splits later on. So just keep that in mind when you're looking at these in the body, that they may not be coming off like obviously separate, but one would continue down into the forearm and one would stay up more so in the arm. And remember, these are cutaneous sensory nerves, so these are going to be very superficial. You'll see them just in that fascia and subcutaneous fat. They won't actually go deep like some of these other nerves, okay? So that was the lateral cord, had your lateral pectoral nerve. Your medial cord had your two medial cutaneous nerves and your medial pectoral nerve. Then if we flip this out of your way, you'll see the posterior cord, and the posterior cord typically has three branches, which I don't know how well you're going to be able to see them. Let's see, maybe this one's a little bit better. Yeah, I think these are kind of still attached, but basically this would be your posterior cord back here, and you're gonna have three branches that come off of that as well. So you're gonna have, they're basically all subscapular nerves. So you have an upper subscapular, middle subscapular, and lower subscapular nerves. So the upper subscapular nerve and the lower subscapular nerve both go to innervate the subscapularis muscle, which remember that's the major medial rotator or internal rotator at the shoulder joint, also a rotator cuff muscle. And then that middle subscapular nerve actually has another name that's, I feel like, more commonly used. It's your thoracodorsal nerve. And so if you remember, that's gonna go down and innervate your latissimus dorsi. And so the latissimus dorsi also does help with medial rotation, but it also does some adduction and a little bit of extension. So those three would be coming off that posterior cord, okay? And that's basically it for the branches. So to recap, we had roots, trunks, divisions, cords, and then our terminal branches. There were 5 terminal branches. You have musculocutaneous nerve and the lateral root of the median nerve coming off of your lateral cord. You have your ulnar nerve and your medial root of the median nerve coming off your medial cord. And then coming off your posterior cord, you have your axillary nerve and your radial nerve. Okay, so those were the 5 like main terminal branches. Then we went over the smaller branches that are kind of all over the place. So we had our dorsal scapular nerve coming off of C5. There's a what's left? We had our long thoracic nerve, which comes from C5, C6, and C7, which you can see there. And then we had, coming off of our superior trunk, we had our suprascapular nerve. We didn't have any coming off of our divisions. And then when we get to the chords, we had our lateral cord giving off our lateral pectoral nerve. We had our medial cord giving off three things: our medial pectoral nerve, our medial brachial cutaneous nerve, and our medial antebrachial cutaneous nerve. And then lastly, we had our posterior cord back here giving off our upper subscapular, middle subscapular, aka thoracodorsal, and then our lower subscapular nerve. And then just something else to keep in mind is that C5 would be giving a contribution to the phrenic nerve. So that's kind of it for those. Hopefully that helps.